as Zainab just said, we're now going to hear from both some of the researchers in the room and some of the youth advocates in the room. So please, can I welcome up to the stage Natalia, Abdulkarim, Charles, and Dr. Sabrina here. And I will start to introduce them. We're honored today to have 4 experts in their own right to share more about what the lived realities of living with an NCD or for a child or young person is. In this panel, we want to showcase that data and stories are the twin engines of advocacy, and that lasting change really requires coordinated strategies at multiple levels, from community to national to local. So we have with us today, starting with Natalia over here, from Jamaica, a social work student at the University of the Commonwealth of Caribbean, a passionate youth advocate for UNICEF. She leads the Fix My Food Jamaica, championing nutritious and food justice policies like front-of-package warning labels, and she serves as UNICEF's Jamaica's National Mental Health Focal Point. Very nice to meet you. A multi-award-winning debater and member of the Jamaica Youth Advocacy Network, she works to ensure that youth voices are respected in decision-making, envisioning a future where nutritious food is a right and mental health is prioritized and young people shape the policies that impact them. And next we have Abdulkarim. He's a medical doctor at Slaves Hospital from Denmark, specializing in endocrinology, and he's Denmark's youth delegate to the UN. He's graduated from Aarhus University with a degree in medicine and a specialization in business and healthcare innovation. He has previously worked with Save Children Denmark and the Junior Doctors Network, the International Federation of Medical Students Association, and the Danish Student Union. And he's passionate about merging medical expertise with global health, including mental health, human rights, and audit solutions. And then we have Charles Branas, the chair of the Department of Epidemiology at Tubman, and professor of epidemiology at Columbia University Mellon School of Public Health. He leads one of the nation's largest and oldest departments of epidemiology and focuses on difficult health challenges tied to basic determinants like brain space, housing, and medical care. He's the founding principal investigator of 2 CDC-funded injury research centers and has held positions at Columbia, Johns Hopkins, Berkeley, Penn, the University of San Carlos in Guatemala, as well as the University of Otago in New Zealand. And lastly, we have Sabrina. She's an assistant professor at the Hillbrook Department of Population and Family Health here at Columbia, and she's also the affiliated faculty with the Child Protection Learning Network, which is co-hosting this event here with us at the Collaborative. Sabrina has nearly 2 decades of experience. She applies epidemiologic methods to study social determinants of mental health and psychosocial outcomes in both humanitarian and forced migration contexts, with a focus on modifiable factors and implementation science. Her teaching covers global and adolescent mental health, measurement, and applied data collection practices. So, wonderful. We're going to do a quick opening question where everyone gets to share briefly from their point of view and their horizon. So when we talk about the link between NCDs and mental health, what does that link actually look or feel like in the real life of a child or young person as you might have met them or don't? I think we'll start with Charles.
Sure. So, thanks. I guess I'll begin by saying that perhaps there's some conflict on the definition, but I consider mental health challenges to be a non-communicable disease. So I think there's infinite connection between them. I guess just briefly to say, I've been going to an island in Greece since I was a child. That particular island has had a long history of tragedy over the century, none of which I've personally seen until one particular year in 2015. There was a photo published of a child that had died on the beach on that island. And I was particularly moved and challenged by that myself, but the island itself had many people then came to the island to support the tens of thousands, if not hundreds of thousands of migrants, particularly children, particularly unaccompanied boys that were coming to that island. And I think it was a good example of what famous emergency responder, disaster response person named Fred Cuny said was, a second disaster upon the first. And there was more support than they needed, and it really possibly made things a little bit worse in the short term. And what was really needed, I think, and I want to hear what others think from their experience. So the kids, and now that we've had a chance, and some others in this room have had a chance to visit and see some of the experiences the children are having in that particular migrant camp and others across the nation. And the real challenges are, yes, they're medical and mental health challenges, but they're also access to food and housing and other very basic services. So I guess part of my comment, just to open up the conversation and answer your question, is I don't know that we always need to think in the absolute most complex terms. I think simplicity has great value here, and when we are right now in the midst of doing something to begin to put all the evidence together from scientific literature to try to get a sense of what would be best in terms of responding to the mental health and non-communicable disease challenges for these kids. But by the same token, I think we're going to start thinking about some of the most simplest things, single brief interventions, single session interventions, perhaps making use of the expertise among the folks in the camps themselves, some of whom are professionals, just like we are. Trying to make use of things and not trying to overcomplicate the situation, I think is a really interesting approach that we're going to pursue.
Thank you, Charles. Over to Abdulkarim.
Thank you so much. I would like to echo what you said as well initially, but I would also like to continue on some of the things that you were talking about, because in Denmark we talk a lot about well-being and feeling comfortable where you are, feeling comfortable in your skin, feeling comfortable in your own body. I mean, that's essential for every person, not just a young person, but as a child. And when we talk about mental health, we usually talk about the extreme situations in humanitarian crisis settings, which are really, really important, and that's also something that I'd like to address later on as well. But we also have to talk about the people that are living in more regular settings as well, who aren't feeling like they belong where they are, or they don't feel like they're having a great well-being. And that's also something that we have to talk about as well, because when a non-communicable disease hits a child, I mean, they start to feel excluded from the society that they're in, they start to feel different. And some of those things can kind of like escalate slowly. It's like a snowball effect. One thing goes to another, and then it just gets more and more and more and bigger and more extreme. And unfortunately, that's what we see with a lot of children out there in the world right now. And it's not just about things that are happening in their own social sphere as well. It's also some of the global things that are happening, like the global disasters, with the climate change. We also see with the wars and crises that are all over the world. I mean, everything that they see on social media also affects their health and their well-being as well. So NCDs are really deeply interlinked with mental health, but there are also a lot of social and structural factors as well that we need to consider when talking about mental health.
Thank you so much. Natalia, from your horizon, please.
Yes, so I think when we speak about the link between NCDs and mental health, I'll speak for Jamaica, it's very multifaceted. So children and adolescents are in their formative years. So they're usually thinking about forming friendships, navigating school, finding out who they are. Managing all of that alongside a condition is tough. So this leads to various emotional tolls. They may have feelings of frustration, confusion, anger. It's hard for them to handle and navigate that, and they may not feel as if they have safe spaces, where they can go to have their issues really listened to and understood. And, even peers who mean well may not understand their condition. So this can lead to things like exclusion and stigma, and that in turn leads to isolation. So I do think that leads to, an effect on one's mental health. So I think there are also various systemic barriers to access. In Jamaica, affording care for non-communicable diseases is expensive. It takes up to like 1/3 of some person's income just to, afford medication. So this produces a financial strain on the household. Young people are also students and they have living expenses. So I love when you mentioned finances as well, because this can lead to prevention from affording things like books and materials from school. And children and young people pick up on things. So even if their parents are like, don't worry about it, they will, sometimes feel like a burden, and that can lead to feelings of, being a burden, which is simply not true, but, people experience that, and that is just like the lived reality. There is also, there are so many factors, so I think I'll just leave it at that.
Thank you. Sabrina, over to you in terms of what are the things that you see?
Yeah, great, thank you. So you all said it already. So one of the things I try to think about is, I'm an epidemiologist, and so we break all these things down. So I think in a part, we're also guilty. We have siloed, we have broken these things down. So something that's been said a couple of times is reality, right? This is reality. We're the ones who have put on this mental health NCD. Kids just see this as reality. And so something I want to flag also as somebody who's really engaged in prevention and child participation is, yes, there are tons of challenges and there's tons of negative consequences, but also, and still, these children and youth are building skills that will serve them throughout life. They are building resilience that perhaps they shouldn't have to, but therefore, if we can help support their engagement in programs, their engagement in design, they can take this experience and instead of it just being, here's the financial and here's the negative consequences, that they can have space to participate and make programs that serve them better. And so I just wanted to add that to the piece. Thanks.
Thank you so much. So we'll go now to just asking a particular question for each of our panelists. So starting with you, Abdulkarim, you said that you had some more to share from your perspective. Can you share an example that explores this daily challenge for children when sometimes navigating these separate and uncoordinated health or social systems?
Thank you for that question. So, as the Danish youth delegate to the United Nations, I'm lucky that I'm in this position, that I'm able to travel around the world, meet young people from all parts of the world, and talk to them about their reality. What do they experience in their regular lives? What's important for them? What affects their mental health? And at the World Health Assembly in Geneva earlier this year, I spoke about the fact that the world that we're living in right now is changing. As also mentioned in the beginning, we see climate disasters affecting the people that are least contributing to it. We see the rise of non-communicable diseases all around the world, and we also see wars and conflicts affecting a lot of young people. And all these factors impact our mental health and also lead to an increased amount of non-communicable diseases. So what we also see is that who do they affect the most? We see that they affect women, children, but also marginalized groups the most. And we need to figure out how to get a hold of these people before it affects them even more. And that's why I really appreciate the comment made by Gregory earlier today as well, because we need to integrate prevention. We need to think more about the one-size-fits-all method that we usually use a lot, because in a standardized setting it is good, but people are different, and also youth are very, very diverse, and they're different compared to which part of the world that they're in. So we also need to tailor the care responses that we do to the people that we need to give them to, but also compared to the situation and the social setting that they're in. And that's something that we really, really need to improve on a lot. You asked me for a story, and I was thinking a lot about it, but I remember once, I'm also a part of the Save Children Youth movement in Denmark as well, and where we talked a lot to young people coming from humanitarian crisis settings or sitting in camps, trying to create their own reality and trying to create their own life the best way possible. And one of the things that they usually talk about, the people with non-communicable diseases, is that the social exclusion. just think about it. I mean, you're a young kid and you just want to have fun. You want to be with your friends. You don't want to worry about when do I have to take my insulin, or can I go out and do this, or if I do this sport activity, what will it do to my lungs? I mean, there are a lot of factors out there that these young people have to think about that their peers don't. And it's one of those things that actually affect their mental health a lot because they don't feel like a part of everyone else. They start to feel socially excluded. And that also moves on to the thing that I also talked about, the well-being. I mean, it leads to reduced well-being. And if a person feels that they're not feeling well in the setting that they're in, I mean, it also leads to issues of fulfilling their full potential. I mean, because they have a lot of thoughts and a lot of worries in their head that really prevents them from going towards the goal that they want to go to, which leads to less fulfillment of their goals and their opportunities in life, which also affects them later on in life as well. And yeah, just to echo one last thing, because I see Marie is looking at me as well, but it's the one-size-fits-all system. I mean, if there's one takeaway from what I'm talking about right now, is that we need to think more about tailored approaches. And now we also heard that we went from 5 to 25 mentions in the political declaration, which is a great win in the multilateral system. But if we talk about the realities of these children, I mean, it's not the 25 mentions that saves their lives. It's the things that we do, the real things that we do, the real actions that we do, and that's what we need to focus on. So thank you for that.
Thank you. Very, very true. It's not about the words, it's about the actions. Yeah, and that's where we also want to get to. Natalia, from your perspective, what has been the single most effective strategy that you've seen and used to get decision makers to genuinely listen to the needs of young people?
That's a really good question. I would say creating youth movements through partnership. So, for example, youth-led movements like Fix My Food Jamaica, as well as the push for the National School Nutrition Policy, with several partners like JAN, which is the Jamaica Youth Advocacy Network, and HFG. They really get young people together and they give them the opportunity to share from their perspective, to create messages that come from them because these issues are affecting for them. So I want to applaud UNICEF and all other partners, especially Jamaica, for always putting young people at the center, which is what we're talking about here today. These movements also, not only do people get to talk about very prominent issues, they are empowered to share their story, develop skills, and to better advocate for their needs. So for Fix My Food, or advocates write letters to the newspaper. We create open letters and we go around to all our friends and colleagues and we get signatures to push for front-of-pack warning labels. So it's just a very hands-on, community-based approach that gets young people involved, and you don't have to worry about losing their interest because they are coming up with the ideas and they are being empowered to speak. So I think that's a very effective strategy, just creating spaces for youth to talk about their issues.
Thank you. I think it's such an important piece that if governments and policymakers actually see the coming together of young people, then that's where the good things are, because they're the ones who are living the reality. So thank you so much for bringing that up. Sabrina, from your perspective, what's the most compelling argument that advocacy can use to convince traditional NCD stakeholders that investing also in mental health is critical to achieving their own objectives?
Thanks, and sort of taking a page from Charlie as well, the NCD mental health divide is an interesting one. I actually think we've had more luck convincing NCD folks to incorporate mental health from a funding perspective than mental health people. So sorry, Charlie, if that's what you're going to say next. But basically, I'm a prevention person, right? And so when I think about prevention and we think about the underlying causes of the most negative outcomes of mental health, they are very similar and synergistic to the underlying causes of the most negative outcomes from non-communicable diseases, right? And so really it's a funding thing, it's an efficiency thing. It's if we address this one issue, education, caregiver support, psychosocial well-being, access to education, that's like 5. But if we start at one of those, right, we're not gonna just see the outcomes on mental health, we'll see it with NCDs. Now, if we want to take a specific example, and it's been brought up a couple of times, thinking about diabetes and maybe taking your medication and accessing all those things, it seems so obvious it doesn't have to be said, but I'll say it, right? That's not possible when a young child or a child is experiencing extreme stress, depression, anxiety, right? It doesn't matter if that's a consequence of the non-communicable disease, a consequence of the diabetes diagnosis, or it's there before. Only epidemiologists like me care about that, right? For the child, they don't care. What they care about is they don't have the testing strips they need when they need them, or they, don't have the right injections and all of those things, right? And so for non-communicable disease folks, is helping those children manage their condition, that will obviously improve, and obviously there's tons of data, will improve their outcomes.
Thank you, Sabrina. And coming back to you then, Charles, when we look at the policy level and advocating for policy change, what do you find to be the more effective? Pushing forward integrated policies as a new standalone, or working to embed mental health components into existing NCD strategies and budgets?
I would say that we need to build on what's existing as a start. That is not to go against the comment that was made earlier about the need for creativity and invention. I think we absolutely need to be thinking about inventing things and new things, and that's the function of science, and quite frankly, the function of having a partnership with the university and universities. That said, I want to come back and say one of the most effective things that I've seen, to follow up on the comments made by Abdulkarim and Natalia, is bringing kids, not just organizing them, which I think is exactly what needs to happen, and the kids and different groups need to, especially children and others, need to initiate some of the ideas and bring their ideas to the fore. But then I found great success in bringing those kids together and taking them to the policymakers in person, that the policymakers have an interaction with those kids firsthand so that they can hear about where those kids have emerged, what their context has been, what they've experienced. And I'll end by saying this, one of the statistics that's always stuck with me on a global sense is that the poorest billion people on earth, those folks, 75% of them are emerging, are either in active civil conflict or have emerged or have been part of active civil conflict in the past 3 years. And that to me is the kind of context that you don't get when you meet someone in a very pristine group like this. It's just lovely here. But when you have the opportunity to have a conversation with kids like that and put that conversation to the fore in front of a policymaker or a decision maker, I think it could really change things and get them to start thinking.
Thank you. I'm going to skip my plan here for the last one sentence answer, and actually ask if there's anyone in the audience who have a question for any of our panelists here. We can take from online as well, and we just need someone to look for that. Yes.
So,
Just a moment.
I'm Jeffrey Reed. I'm the director of the Columbia WHO Center for Global Mental Health, which is one of the co-sponsors of this program. It's great to see you all, and Sabrina, congratulations. I guess one thing I'm curious about sitting here is there's many things that are technically communicable diseases but have dramatic effects over the course of people's lives. So, what's the difference between NCDs and, living with HIV, which is technically communicable? What's the difference between NCDs and hepatitis B? So, I wonder if we are creating sort of another divide by making the separation between NCDs and communicable diseases, and that what really we ought to be talking about is integrated care models. I'm going to cheat and ask you 2 questions. The second question is about that the health equity risk factors for NCDs and mental health are the same, exactly. So
I will take the first one because Jeff, you don't know this, but actually when we were talking and preparing for this, I was thinking of an example of tuberculosis. And I kept going, nope, Sabrina, nope, that's infectious, don't bring it up. So thank you. I mean, I do think we are, again, creating that a bit. The example I want to bring up is related to multi-drug resistant tuberculosis and just tuberculosis in general. So for those of you who are less familiar, the very first drug and the very first trial that treated tuberculosis was also the very first time we created drug resistance, because you have to take tuberculosis pills all the time, and we can't. As a society, we can't. And as a social epidemiologist, that's a purely social issue. So we have the medical way, or we did before all this resistance, but we couldn't figure out how to support individuals, how to support communities, how to support logistic chains, so that people are getting the meds and are empowered to take the meds and aren't feeling stigma when they need to take it. I wanted to bring that up, but I'm like, multi-drug resistant tuberculosis is in fact, that same thing applies to so many non-communicable diseases, right? And I so think similarly, we just need to, instead of separating ourselves, which we have to do for funding calls, we need to find better ways of harmonizing and coming together.
Anyone for the second question? One of you?
I'll just say briefly, I think I'm so glad someone asked about HIV, because until recently, that was heavily supported by HIV research and services around the world. And that has, I mean, we have good evidence of success with that. But I think, not to be forgotten, to your question, there's good evidence of other non-HIV conditions that were also positively affected by all that investment, and that speaks to the nature, the evolving chronic nature, long-term nature of having HIV.
Thank you. Now that was 2 questions and that was rich answers. So I think we're going to go to the next and final panel. So thank you so much everyone for joining and sharing your perspectives.